Hey everyone. So today, in honor of Lyme Disease Awareness Month, I want to continue our conversation forward towards a topic that is so important and really often asked about. And it is, how in the world do we deal with the intense pain that is often associated with a Lyme infection? Now, the answer is going to be pretty layered because there are many different causes of this pain and because the illness really does affect everybody so differently. And so it's important that we understand going into this that this is not an exhaustive list. It's actually a very, very brief one. And while these things may have helped me historically or other people that I love and know, it doesn't necessarily they're going to be the exact right answer for you. And we have to be okay with that. I'm hoping today that something in our conversation helps you feel a little bit less alone and a little bit more prepared for whatever lies ahead of you. And so with that, it's really great that we know that in Lyme, there are truly so many causes of pain. There's going to be three that are kind of reoccurring the most often, and that's going to be the joint pain caused by the actual inflammation that the illness brings on. So that genuine building of pressure inside of the joints, often feeling like throbbing or kind of that like toothache feel throughout the body. And so there's the joint pain. There is going to be this often build up and then a release of histamine associated with Lyme and other vector-borne illnesses. And this histamine is directly associated with a powerful muscle pain. And so this can happen truly anywhere throughout the body. Sometimes it's localized to certain places. A lot of people talk about leg pain, or it can be head to toe all over. And then there's this really tricky and just dreadful type of pain here that is actually happening at the nerve ending level, creating this inflammation and ultimately this really intense activation of the nerve endings themselves. And so it's just sending powerful, repeated, repetitive pain signals to the body. And this happens, or to the brain rather, and this happens all over the place. And it can come on out of nowhere, or it can be pretty constant. It is dreadful. It is dreadful. Now, the thing about these pains is that it's not just one of them for most people. And again, this is not an exhaustive list. And so most people who have been dealing with this illness for a long time are either dealing with all of these on a daily basis or this kind of cycling madness of one to the next. Now, when I had Lyme back in the day and during my most painful times, I felt very alone in it because it was so complicated to express just how intense the pain was, how relentless the pain was. And there was really kind of this underlying side of it where in my journey, I didn't receive a diagnosis for like almost a decade of having this illness, despite the fact that we searched and searched and searched. And so I would ultimately frequently be told by medical care providers as well as my peers and colleagues that the pain was all in my head. And not only is that very insulting, but it causes almost this internal dilemma inside of you, where when you're being told over and over and over again that the pain you're experiencing is not real because they weren't able to detect a tangible cause at that time, you almost grow this attachment to it, and the signals just feel louder. They feel more intense because every time your body says, ooh, pain, there's this anger that builds up inside of you, or there's this, I told you it was real, it's really happening. And so there's this hyper awareness to all of these layers of discomfort, and it can become so isolating. We can add on to this the fact that sometimes the pain is truly so deliberating or debilitating that we just can't even find our energy or our ability to use our words. And so somebody will keep saying, what's wrong? What can I do to help? Or just totally oblivious to it. And it's like every time that question would be asked, everything just felt more intense. And in hindsight, I now understand that a lot of this intensity was caused by the nervous system overwhelm that I was experiencing and that a lot of other people were experiencing. And so when we think of trying to combat or resolve the chronic pain that is associated with an infection like Lyme disease, we really have to be gentle, patient, and creative. And I have talked in past videos and will continue to talk in future discussions about something called terrain theory, where we like to focus on the overall experience of the body, the overall existence of the body, and do everything we can to kind of bring in solutions. So it's a lot less about trying to squash something, trying to squash the pain, and a lot more about just supporting the body in handling it. And so in this case, that looks a lot like soothing the nervous system and reminding the individual that they are safe, they are not alone, and that people are really listening and willing to continue to listen. And so we're going to kind of rapid fire go through a few of these resources, and I will encourage you strongly to reach out with questions. Please reach out with questions or suggestions on where to elaborate in the future. And so the first thing that is so important when you are dealing with pain, and this goes for all kinds of causes of pain, is proper hydration. In order for your brain and your nervous system to function in a way that is safe and effective, you have got to be hydrated. Now, this probably feels insulting to say something so simple to kind of resolve a problem that is so complex. And I am both sorry and not sorry about that because it is so important. So we typically kind of recommend as a baseline or a general goal to work towards is the consumption of fresh water in the amount of half of your body weight in ounces. So that's kind of like a weird mouthful of things to say. If you were a 100-pound person, maybe you would try to drink about 50 fluid ounces of water every single day. Now, theoretically, if you're also drinking things that maybe would counteract your actual hydration, like say coffees, tea, soda, things like that, alcohol, you would want to also add in equal parts, like ounce for ounce of those beverages back into your diet in additional water. But sometimes that is just a lot, and so it's something to work towards. I will tell you almost every single time that I have gone through this with somebody, when somebody is drinking a very small amount of water and they increase it even just by a little bit, within a few days they notice improvements. And so don't get too hung up on exactly what you need to be drinking, and just kind of play with this idea that maybe a little bit more would be a little bit better. Now this helps so much with pain relief, and we could talk about it for years probably, but let's just move on to the next thing, which is going to be kind of silly, but focusing on the lighting in a setting. Now, pain, when you have experienced it for so long, or when it is so intense, it's a signal. It is a loud and consistent, powerful signal that your body is having to interpret. And so when we start adding in other outside signals or stimulation, it can be really overwhelming, and it actually kind of turns up the volume of the pain that the person is experiencing. And so what I found in my personal experience as well as in my professional life is that sometimes lighting is one of the biggest components or easiest to resolve components of somebody dealing with chronic pain. And some general things to kind of consider here is the warmth versus the coolness of the lights. So thinking of that more yellow tone versus blue tone. I'm not going to tell you either one is better or worse. They're both found in nature in different places. But what I will say is pay attention to how you feel. For myself, I feel so much more at ease and comfortable when I'm around those warmer tones of lights. But I know other people, including those who have received Lyme diagnosis, that do better on the opposite side of the spectrum. So there's the warmth versus coolness aspect. And then we can add into this as well LED lights. Now, this is not going to be something that affects every single person, but sometimes it's another hidden key to just bringing in more comfort when we're really needing it. Sometimes, for some individuals, when they're surrounded by the LED lights, they can either visibly see or almost interpret or are affected by the way that those lights are actually flashing pulses. And so maybe when they look through the room, they might not technically notice that there's a strobe effect, but the pain is there. And so if you are somebody who is experiencing chronic pain and you are living in a home that does have the LED lights, which have plenty of, benefits to them financially, sustainability, all of those kinds of things. But if you are somebody living in a house that is lit with LED lights and you're dealing with this chronic pain, my suggestion would be to give yourself a couple of days where that's not the light that you're existing in, and just see if it makes a difference. For some people, it genuinely does, and for some people, it doesn't. But I mean, why not look into it, right? And so lighting is going to be a big one. And then we can kind of move forward to, on that same concept of outside stimuli being intense and sometimes intensifying that experience of pain. And this is something for me that was really big and significant, but difficult to pinpoint at the time. And it is movement around you, movement in the space around you. So for me, I was ill enough and weak enough that I couldn't really move my body at all. So I was in a space of stillness, but sometimes people would come into the rooms that I were in and they'd be moving a lot, or somebody would put something on a TV and it would just be a lot of movement. And in the same way that sometimes lighting can just create that overwhelming stimulation, the same can be said for visual activations like seeing movement. And so for me, when somebody who was maybe more active or hyper or excited would come into my line of vision and they'd be moving, even just like I am right now, moving the hands, hand expressions, let alone throwing balls around or playing like a lot of children would do, when that movement would come into my space, it's like my body would start to tighten more and the feelings would just become so much more intense. And so that is one thing to consider. And it's truly something that for me became emotionally challenging, because I would notice that when certain people would come around, it was like everything felt more intense and it did hurt more, but I couldn't explain why. And so I would end up just kind of quietly sitting through it and becoming more uncomfortable versus trying to have a conversation about it because I was afraid of hurting their feelings. And now knowing this and understanding this, it's much easier for me to be able to put that on somebody's radar that it might just be influencing it. And then you can have a compassionate and like proactive approach to dealing with that hyperactivity around you. Of course, same could be said for sound. That's a commonly talked about topic, and we know that sound influences things. Let's start thinking about a little bit more of supplemental stuff. Now, I am not a huge supplement pusher. I have a lot of feelings about the supplement industry, and I'm not going to bash it, but I'm just saying, like anything, we need to be educated and aware, and sometimes more is not always more. But one thing that for me has been incredibly helpful is magnesium. So simple, magnesium. You could take it orally, of course, many people do. There are powders, there are pills, there are gummies. For me, in my experience, topical magnesium is the best. We know that research shows us that when you apply it transdermally, it's the fastest that it is absorbed and the highest rates. So transdermally just means through the skin. So for magnesium, it's one of those supplements that is really easily, for most people, sucked into the bloodstream through the skin, and it comes luckily in tons of different oils and lotions and gels. For me, I find that sometimes the lotions feel the coziest because the gels might leave some stickiness or like tighten on your skin. And if you're already dealing with a lot of sensory stuff, sometimes you don't want extra sensory stuff, but there are some fantastic options out there for that transdermal magnesium. We can of course remember too that Epsom salts, really lovely soaking, can be helpful. And for me, with how weak I was, it was really challenging for me to like be toted off to the bath and then filled in a big bath full of Epsom salt. There was a drowning risk, of course, if nobody was right next to me because of being so weak and unable to hold myself up. But luckily for us, we know that even just a more concentrated foot soak with Epsom salt can get you pretty far. So if you are dealing with an intense situation like I was at the time and mobility is a factor, get yourself a little bucket and put your feet or put your hand in there and just see if it works, because it really, really might. The other and really only other in this conversation supplemental component that I would bring up here is going to be perhaps controversial, but let's talk about it anyway. And it is CBD, cannabis, things within that realm. It is so important on the topic of supplements to understand that education is everything, and not all products are created equally. And so it is so, so vital that you research any product that you consume, right? We really, really hope so. And this is not just a blanket recommendation. I will never make a blanket recommendation. This is just something that for me and my experience was really helpful. And it is so nice too to understand some of the reason why. And let's kind of just so briefly compare the narcotics, so the opioids that I was prescribed very, very heavily versus the CBD type products, and just see how they work differently in the body. So the opioids work by, of course, attaching to the opioid receptors throughout your body. And then from that receptor location, they are blocking out pain signals. And so that's why they work so well, so quickly. However, we also understand that they are associated with addiction very heavily. They also have been associated with all kinds of internal issues, which you could unpack for hours and hours. But then, of course, one of the most important things to understand when you're dealing with chronic pain that may not have a resolution coming up real quickly is the fact that they are also associated with very quick tolerance buildups. So that means if somebody is dealing with pain day after day after day, and it's more chronic versus short-term and acute, they're just not sustainable. So not really safe, not sustainable, and lots of other reasons that they may not be ideal for every person. Let's look at the other side of it and think about CBD and understand that it works a little bit differently in how it processes pain responses for people. So instead of working just on those like pain receptors like the opioids do, CBD products actually work on your endocannabinoid system, which is all throughout the body, and it works very closely with your autonomic nervous system. So thinking about things that you don't control necessarily with your mind throughout your body, digestion, heart rate, all of those things that are just sort of happening. So those internal functions. It also is really closely knit with kind of your nervous system in general. And so we already talked about how that overactive, maybe poorly activated nervous system can become just snowballing when it comes to pain. So when we think about the CBD side of things, it's actually binding to endocannabinoid receptors and changing the way that you feel pain, by actually on the opposite side of things of reducing how that pain is interpreted. So we're not blocking something off, we're not cutting something off, we're changing the way that we feel things. It is also often associated with a more kind of systematic relaxation within the body. Of course, this is not going to be everybody. We know that sometimes paranoia and things like that have been associated with it. And so as always, it is case by case, it is person by person. But then the other really fun thing here is that it's actually been genuinely associated with, through a couple different studies, the reduction in inflammation itself. So we do not see that with opioid use, but then with CBD, it's actually been shown to reduce some of the actual cause. So remember when we talked about joint pain, there's this actual response of inflammation building up. CBD not only is helping the way that we interpret that pain by kind of softening the blows, but it is also then reducing potentially that inflammation that caused some of the pain to begin with. And then because it's working so closely with your autonomic nervous system, for many people, if it is the right supplement for them, it's going to actually enhance or balance out the way that that autonomic nervous system is working to begin with. And so kind of in this wild connected web of things, if you think about how digestion is associated with that, and backed up digestion has been linked to pain, let's go ahead and smooth out the digestive system, enhance that, and you could just kind of turn that attention towards so many parts of the body. And so for me, that was something that was really helpful. Always do your research. This is not a blatant recommendation. It's just something that we might want to look into. And then on kind of it'll sound kind of funny, but it's been researched beautifully, is that there's this combination for pain relief where you take cold exposure or cryotherapy and combine it with vibration, and it's more localized, so I've never done it like across the whole body, of course, although, well, we'll talk about that another time. And so with this combination of cold and vibration, say somebody was dealing with like the knee pain, that like isolated knee pain from their Lyme infection, if we take, and this is beautiful, if you take cold and then place it on that space, as well as something that would cause kind of an intense vibration, so there's those muscle wands, all kinds of things, if we were to place them both on that area, within a few minutes, what starts to happen is the body will actually, and this is kind of like dumbing down some of the words, but the body will actually say, okay, there's a lot of stimulation over there. I have assessed the situation. The vibrating is not harmful. The cold is not harmful, but it's confusing, and focusing on those sensations may make me miss something else that's really important. And so the body will just kind of turn down its attention to that area, hence reducing the pain experience. I think it is amazing. Kind of side note, kind of not side note, in a lot of hospital settings or kind of specialty doctors' offices, they actually have a little product called Buzzy Bee, and it is a vibrating small ice pack that they use a lot of times for more pediatric care, that will be placed on the arm before IV placement, because it will, again, vibrate, it's cold, it's kind of confusing, and the body will just eventually turn it down. So for those kids who are afraid of the pain of a prick, that can also be applied there. So kind of fun. And then the last thing that I would touch on, and I absolutely have intentions of talking about this really in depth in the future, is something called neural mapping. And it is essentially creating this network of strong associations to comfort that you can kind of draw on in times of need. And so the concept is that you can kind of bunch together or layer up these experiences. They don't all have to be associated with comfort, but maybe some of the core ones would be. So let's say maybe that is, I don't know, cuddling and snuggling your mom. Mother's Day was yesterday. So let's say cuddling and snuggling your mom is a comfort experience for you. We could cuddle and snuggle, and then we start to add on these other parts of the experience. Maybe we bring in a specific smell and put that to the same experience. So now you're cuddling and you're snuggling and you're feeling comfort and you're smelling the specific smell. What if we were to then bring in a certain color? Maybe you always cuddle and you snuggle and you smell this certain smell, and you always use your favorite green blanket. And then let's say, let's add in another experience. Maybe it's a certain sound. Maybe it's a type of music that you listen to. Maybe it's opening the window where you can hear the birds or the wind or the wind chimes. Or maybe it's even the sound that you hear when you focus on your breath really closely. It could be anything at all. And you can just keep layering in these experiences where maybe originally that green blanket didn't really make you feel that comfortable, but now when you see that green blanket or you smell that certain smell, it pulls on this memory of this experience of comfort, and it almost beautifully tricks the body into bringing that experience to the forefront. Now, this is probably the most important thing that I ever have experienced or learned about, because the truth is, in those hardest days of Lyme, and coming off of the intense treatment and all of the things, those dirtiest, darkest, hardest days, I was so far into the pain experience, emotionally and physically, that I could not grab onto anything that felt comfortable. I couldn't. I was so lost. I was so terrified. Everybody around me was so terrified. Everything was so extreme that it was like living in a dark tunnel where the pain just never went away. And so when neural mapping started to become something that we were experiencing intentionally, it was like I got to start rewriting my life experience. And again, I will go into this so in depth in the future, and more of my own personal examples of it, as well as some options that have worked for other people, and they may also work for you. But today I would just say, for me, it was a huge component of survival and how I made it to where I was. Because if you remember my story, we had to seek the answers. There was never a caregiver who ever had all of the answers. We had to fight really hard to find them. And had I not started to find ways to ease the pain, I never would have been able to focus to read those textbooks that we thrifted. I never would have been able to fully comprehend the conversations that happened around me. And so when we dig into neural mapping in the future, I want you to know that I have so much thanks for every person who was involved in those layering of comfort experiences. And I look forward to highlighting you in the future. But for today, let's just say there's a whole resource there called neural mapping, and I can't wait to teach you about it. And so hopefully, again, something in this conversation can act as a form of comfort for you. I want you to know that you are not alone. You are not alone. I will say it as many times as I have to. And you are loved today, whether you are a caregiver, somebody who has no relationship to Lyme, or you're somebody who's walking through it yourself. I love you. I care about you. We're going to keep shining light on this, and we are going to keep pulling the education to the forefront. We've got this. You've got this. Bye.